Hello everyone and welcome to this audio podcast. This audio podcast is part of the ShiZMode Chapter. This audio podcast is part of a analysis and expose on lobostics, and this audio podcast is part of a Shitstorm Panzer. This audio podcast is part of the Geronimo, and this audio podcast is part of a Storm Lobostics production. In this audio podcast, look at sort of practice aspects of applications or implications to practice, implications in around practice and recommendations. So tech that helps sort of streamline and integrate data into support data to support sort of medicines use and monitoring, for example, of nephrotoxic meds is and can be important in patients with for example, in patients who are suspect or risk for AKI or acute kidney injury, or CKD risk, chronic kidney disease risk. It would be advantageous to see how tech could prompt more timely referrals, if timely referrals are all where applicable in amongst suspect or high risk populations, and in this regard, sort of clinical trials between sort of types of tech and interventions would be advantageous. Digital tech or tech and data science aspects of data science and techniques can improve sort of the identification of individuals who may be at suspect or high risk from in around sort of treatment modalities, and thus reduce delays in review and monitoring and referral signposting to specialist services as necessary. The use of nephrotoxic medicines may be appropriate or applicable in some individuals. At the same time, smarter collaborations are also required between healthcare professionals, and aligned to sort of aspects aligned to between healthcare professionals and aligned to between healthcare sectors, and around additionally in around aspects of aligned to tech. That draws this audio podcast to a close. This audio podcast is part of the ShiZMode Chapter. This audio podcast is part of the analysis and expose on lobostics. This audio podcast is part of the Geronimo, and this audio podcast is part of as part of a Storm Lobostics production.